Hi, Professor Bachi and our fellow classmates in neurotoxicology. My name is Komila Ibrahimova,
I'm Alyssa Rizzuto.
and our presentation is on the neurological complications of chemotherapy. So, just a little overview of what we're going to go over in this presentation. We're going to give you guys some background information on the topic and then discuss the specific neurological effects of chemotherapy and then the environmental effects of the treatments, as well as possible future treatment and therapeutic strategies for prevention of the neurotoxicity.
So, going into some background information, what do we actually know about chemotherapy? So, what is cancer? In short, cancer is controlled cell growth that affects individuals of all ages and of any sex. There are many different types of cancers. Some are more common than others. These include breast cancer, prostate cancer, skin cancer, colon and rectal cancer, and other types such as liver cancer and lung cancer. So, one way that these cancers grow in an individual are based off of their stem cells. So everybody has stem cells, and they are a system which produces new differentiated cells throughout the body. You can see this in the image on the bottom right-hand corner on the left side under normal differentiation. You can see at the bottom in yellow, the differentiated cells are very regulated, and these turn into differentiated cells like muscle cells, cardiac cells, etc. And then cancer stem cells are rapid incorrect growth of the stem cells, which lead to tumors. So once again, in that image under cancer stem cell hypothesis, you can see how the once regulated yellow line of cells is now no longer regulated. It's now very irregular, causing rapid growth, which then leads to these tumors. Um, and moving on into our next slide, this leads to the use of chemotherapy. So, chemotherapy is a type of treatment that helps kill off the cancer cells in specific localized areas, sometimes involving radiation. This is known as radiation therapy. So, chemotherapy is not the only treatment that is used, but it is the most common therapy that is used. So, one example that we see this in is within pediatric brain tumors. So, some of the most common drugs that are used are vincristine, vinblastine, cisplatin, and just other drugs in general. So the usage of these drugs have many side effects. One of the most common that people do know of is being hair loss, but other severe side effects of these drugs cause neurological issues like encephalopathy. And we're going to go into more of these side effects in the rest of our presentation.
All right, so getting into what exactly chemotherapy-induced neurotoxicity is, by definition, it refers to damage to the nervous system by anti-cancer drugs. As we can see in the image on the bottom right, the nervous system is divided into two parts. So the central nervous system, composed of the brain and spinal cord, and then the peripheral nervous system, which is everything other than the brain and spinal cord. And chemotherapy can affect both of these systems separately and in different ways. So, in terms of the peripheral nervous system, this is the part of the nervous system that is most commonly affected by chemotherapy. And chemotherapy's damage to parts like peripheral nerves can lead to peripheral neuropathy. In terms of the central nervous system, damage to this part of the nervous system can lead to cognitive and behavioral issues, as can be expected, because the central nervous system encompasses the brain, which where all of our cognitive processes take place. And the nervous system is particularly vulnerable to chemotherapy-induced neurotoxicity because neurons have limited ability to regenerate. And the peripheral nervous system, specifically, for example, is not protected by the blood-brain barrier that protects the central nervous system. So this makes it especially vulnerable to direct and indirect toxic effects of many anti-cancer drugs. And additionally, many anti-cancer drugs are small in size, which allows them to cross the blood-brain barrier and cause significant damage to the central nervous system. All right, and then we have the specific neurological effects of chemotherapy, starting with the peripheral nervous system. So one type of neurotoxicity induced by chemotherapy is called chemotherapy-induced peripheral neuropathy, also referred to as CIPN, being the most common adverse effect of the most frequently used anti-cancer drugs. It predominantly affects sensory neurons, and it it symptomatically develops as a glove and stalking neuropathy. And the glove and stalking refers to the fact that it primarily affects the hands and feet of individuals. You can see this in the image on the right, which highlights the hands and feet, as this is where most of our peripheral nerves are located. And CIPN has a lot of variance in duration and severity of symptoms. For example, in acute CIPN, it will usually resolve after finishing chemotherapy. However, in severe cases, chronic CIPN can manifest as symptoms that persist for weeks or even years. And in very small cases, it can also emerge shortly after finishing chemotherapy. So the symptoms won't appear during the duration of the treatment, but it will after stopping it, which is interesting. And this phenomenon is called coasting. Symptoms of CIPN can be divided into sensory and motor. So for sensory, patients can experience numbness, tingling, pain, and for motor impacts, there is proprioception changes and sensory ataxia, which increase risk of falls. So this is how the body perceives itself and its environment and controls its motor functions. And of course, impairment to it can put patients at risk of physical injury and things like falls. And CIPN is also a very dose-dependent toxicity, which means that risk of getting it increases with repeated and cumulative exposure. And then to go into even more detail, we can discuss the specific classes of drugs that cause CIPN and their clinical presentation. As we can see, this goes back to my last point of saying that there is a lot of variance in the symptoms and the duration based on which exact drugs are given to the patients. And these drugs can cause damage via specific molecular mechanisms, and these mechanisms can include mitochondrial dysfunction, popular amongst platinum drugs and bortezomib, and this ultimately leads to oxidative damage in cells. There's also microtubule disruption present in the drugs below, and as microtubules are important in cellular transport, disruption to their function can cause damage to axonal transport. And then the sodium VOC pathway is oxaliplatin related, and imbalance in it can cause toxic calcium accumulation, which ultimately leads to axonal damage. And then the last two are SARM1 protein and neuroinflammation, which are a little bit less studied than the above ones, as they are seen mostly in rodent models, not in humans. But besides that, they are still being heavily researched now, as in the rodent models, the lack of the SARM1 protein and lack of neuroinflammation and their modulations can were shown to help prevent CIPN development and protection against these drugs.
Okay, so now diving into the neurological effects of chemotherapy on the central nervous system. We know that the central nervous system consists of the brain and the spinal cord. Therefore, when the chemotherapeutic drugs affect the central nervous system, it affects the individual neurologically. So this includes encephalopathy, ataxia, which is known as our muscle weakness, and seizures, which all harm the brain based off of the drug that is being used, specifically the chemotherapeutic drug. Additionally, this brings the idea of quality of life into play, which discusses if these effects from the chemotherapy drugs affect the individual's day-to-day life negatively, like if this affects their ability to walk, talk, etc. So this toxicology is caused based on a high dose of chemotherapy that passes through the blood-brain barrier, allowing for these drugs to go into the central nervous system and infect it. So lower doses of these chemotherapeutic drugs are used to help control the neurological issues that follow along with it. So some of these symptoms that include are headaches, vomiting, and seizures. So going into radiation therapy, this attacks the tumor cells when they divide. This mostly affects children, more than it does with adults. And with the radiation therapy, a lower dose is used. So there is a short and long-term neurological effect, which lead to vascular complications. Another effect is cognitive dysfunction, which incorporates memory issues and memory loss, short and long-term memory loss. So one example is through the drug temozolomide, also known as TMZ, which makes drugs that are usually unable to go through the blood-brain barrier now able to pass through it, affecting the central nervous system by attacking it with now introducing these new unknown drugs. So this is because the blood-brain barrier, like how Komila said previously, acts as a blockade, allowing only certain small molecules that are non-toxic to pass through. But when drugs begin to affect the blood-brain barrier, this then allows it to attack the central nervous system, causing neurological issues. So there are many mechanisms that were introduced to us that were used. So one being the blood-brain barrier itself, giving these individuals these neurological symptoms, like I mentioned, like headaches, vomiting, seizures. And then another mechanism that was mentioned in the articles that we were given was a study in mice regarding the ICANs, which is a treatment of CAR T cells that cause meningeal inflammation. So inflammation being another mechanism of the neurotoxicity in the central nervous system. So moving on into this figure, we see the common drugs of chemotherapy that are used and their neurological side effects, as well as the duration of the side effects itself. So previously I mentioned the TMZ drug, and right next to it, you can see that it causes headaches, it can cause worsening of focal neurologic symptoms, and how it increases the permeability of the blood-brain barrier and how this occurs in the initiation of therapy. So when the drug initially is introduced to the individual. So you can see that this is very fast acting, high dose dependent, and it gives these neurological issues. And you can see this throughout the entire drug list that is given to you in the table below. So moving on to the environmental effect of the use of chemotherapy, um, we can see how um, the one major effect of chemotherapy is based off of how it is actually disposed. So when it's improperly disposed in the sense where the drugs itself, like the medication, is not being thrown out properly, it's being put out into the world. It affects our water supply, um, which becomes a pollutant. It contaminates their water, so it affects the fish, and it decreases their reproduction rate in the sense of it damages their DNA, so it goes into their offspring. So overall, chemotherapy is deemed to be harmful to the environment, regardless of the benefit of the individual receiving the treatment is. So human waste and improper disposal of the drug itself are many ways that chemotherapy is being exposed as a polluant, affecting a variety of areas within the environment. So just to go over a little bit of a timeline. So first you have the incorrect disposal of chemotherapy, which becomes a waste from the patient itself. Um, it contaminates the water sources, which affects obviously the fish. It also pollutes the air and the water and affects the DNA of the fish itself, which affects their reproduction. So now this is also affecting a food source of ours because many individuals eat fish. So it goes back into a cycle.
All right, and now that we've discussed um, the consequences of the neurotoxicity of chemotherapy, we'd like to move into the treatment and therapeutic strategies, so various therapies that can be used. Okay, so therapeutic strategies as of right now are pretty limited as research is not that far advanced, and neurotoxicity is especially hard to point out and treat. Often because it can be masked as normal cancer symptoms as well. But the top recommendation to limit chemotherapy neurotoxicity is to reduce dosage or delay the treatment. There's also in a suggestion to increase targeted therapies over general chemotherapy. So actually pinpointing what exact type of cancer an individual has and the molecular mechanisms and crafting targeted therapies to treat it. There's also symptomatic treatment, which is useful for after the neurotoxicity has already manifested and shown symptoms in an individual. For example, there's a modest recommendation for use of duloxetine for treatment of CIPN, like the pain that people feel, and then but there is minimal research showing positive outcome of this medication, which is pretty common across these symptomatic drugs. And then in terms of the central nervous system, um, metformin can be used to recover cognitive functions, and then sodium thiosulfate is a less toxic drug that can be used that also provides protection against ototoxicity, which is dealing with hearing loss, which was common in especially in the pediatric brain tumor cases. And then finally, supportive care is just kind of emphasizing a holistic approach or like a more well-rounded approach, which can be, for example, increasing physical activity, which has been proven to improve cognitive function. Also, there's recommendation to improve in neuropsychological evaluation, diagnosis of neurotoxicity, understanding actual pathogenesis and mechanisms, and evaluation of biomarkers to determine an individual's predisposition and their vulnerability to these neurotoxicities. Um, and just to kind of wrap things up and go over some key takeaways from the presentation, as we saw, chemotherapy and other anti-cancer drugs can cause significant neurotoxicity affecting both the peripheral and central nervous system, which manifest in different ways. Peripheral neuropathy specifically is the most common manifestation, and it is caused by dose-dependent and cumulative exposure to chemotherapy and anti-cancer drugs. In terms of the central nervous system, neurotoxicity there can lead to cognitive dysfunction, encephalopathy, and other symptoms that arise from disruptions in the blood-brain barrier and neuroinflammation. Chemotherapy-induced neurotoxicity is also caused by a variety of molecular mechanisms that I went over. This can include mitochondrial dysfunction and axonal damage, although the exact mechanisms still remain unclear. So, I want to emphasis on continued research on this. Management of this neurotoxicity remains limited to adjustments in dosage, symptom management, supportive therapies, and other preventative measures, which is where we're really at in current day. And throughout all of this, we can see that there is a very critical need for better neuroprotective strategies and drugs. So, medicine that can protect against neurotoxicity and prevent it from actually harming the individual. Biomarker research and interdisciplinary um, and multidisciplinary collaboration to improve patient quality of life while they continue to receive necessary and effective cancer treatment. And these are just some of our resources. And that's it for our presentation. Thank you for listening, everyone.
Thank you.